as regards to tort reform, you know, the issue is not so much the cost of malpractice to me. It's the cost of malpractice to the rest of the country in defensive medicine. It's the ordering of tests and procedures and so on and so forth that I know are going to be negative. But I know if I don't order them, I've opened myself up for a frivolous law, easily filed suit against me for not getting something if 1 in 1,000 chance or 1 in 10,000 chance it happens to show something, which in all reasonableness is unlikely. So it's the cost associated with defensive medicine. The other tort reform that's not even mentioned is the tort reform that also drives up all the sorts of costs that I see probably in a disproportionate volume as a neurosurgeon is somebody involved in a fender bender or any sort of accident. They've got 10 phone calls from attorneys within a week, or attorneys' offices telling them that they need to go and get tested and worked up and diagnosed. Well, nothing's wrong with me. Oh yeah, it could be something wrong with you. So there's another cost of tort reform that it's not malpractice tort reform, but tort reform in the sense of, these people are told, basically, we'll get you a check for 3 times whatever medical bills you run up. Now you talk about an incentive to run up bills. Well, they come to my office and say, Doc, I need an MRI of my head, my neck, my back, my shoulder, my foot, everything. Because they know that in the end of the day, they're going to get a check from somebody's insurance company, which, like you said, they ain't paying for. I've unfortunately been a victim of one malpractice. Unfortunately, I'd like to be 0, but I've been practicing 15 years, and I've had one suit filed against me for failure to order an MRI soon enough. Well, the fact of the matter is, fortunately won that case, but the patient didn't need an MRI. But I'm going to tell you right here, right now, no question about it. I'm not even going to think about it. I'm not going to spend a week of my life again in some courtroom defending myself because I didn't order an MRI that I knew they didn't need at the time. I'm going to order it like that. And why? Because it doesn't cost me anything. And I'm not going to face that situation again. I'm practicing good medicine, but good medicine, may not be the best thing when you're going to get sued. I'd ask you to put yourself in my shoes and say, well, I know I've got malpractice insurance and it'll pay if I lose. Well, no, I don't want to be there for a week defending myself. I don't want to go through the emotional cost of a suit that I know is right. I'm not going to, the answer to your question is America overserved? Yes. But America's overserved because we're forced to overserve Americans.